Hello there and welcome to another edition of our program today. It is Health Matters. I am Utube Archibon, your anchor. And every week we bring to you different topics concerning health and how seek ways, and we also seek ways to handle different health challenges. I am not here alone because I have with me in the studio a health expert. She is Dr. Elizabeth Imo, consultant, public health physician and wellness coach. We'll be talking about stress management. This is an issue so many people do not pay attention to, but believe me, it is doing so much harm to individuals than good. That is why we deem it necessary to bring in guest health experts to discuss and let you know the dangers that are associated with stress and how to manage them. If you don't properly manage stress, it may lead to something more serious. So you're welcome to our studio.
Thank you for having me. Hello everyone.
They're talking about stress and how to manage it. Stress management. Doctor, a lot of persons, like I was introducing the program, do not really give attention to themselves, their bodies. Considering the economic realities today, we work and work and work. We are stressed at home. In the offices, we are stressed, and some persons are in the farm already. What do you have to tell the public? What do they need to know about stress?
Okay. Stress is a physiological response to perceived threats or challenges. That means the way an individual or a person responds when he or she is faced with a challenge. It could be acute or chronic. When you talk about acute stress, it is short-lived. It takes about few hours to few days and it will be over. Chronic stress lasts longer than weeks into months and sometimes even into years. And then we have good stress and bad stress.
Okay, doctor, acute and chronic. When you talk about acute, you say it's short-lived. Does it just come and go? Like it lasts for 2 days, 3 days, or probably a week, and before you know it, somebody snaps out of it? Does it just come and goes without doing anything about it?
Okay, so the acute stress, like I mentioned, is short-lived. It doesn't last long, though the intensity is overwhelming, but it lasts for just a few hours, sometimes days. You have such a stress when you're reading for an exam, which does not last for too long, or you're preparing for an interview. Immediately you're done with that activity, that stress would be over. That is different from chronic stress, which is ongoing, it is persistent, and could last for a longer period of time and will give rise to complications.
How long are we looking at when we're talking about chronic stress?
Chronic stress can extend even into years, from weeks to months and years. Chronic stress is long-lasting because the intensity is not much. It is low in intensity. People will not really be able to identify that they are going through stress, and it continues to accumulate over time until it becomes chronic stress, and then they begin to exhibit the symptoms.
People may not be able to identify they are going through stress. Then what then are the signs? How would they know and then get to meet a doctor? Because you can't just feel tired. People work and they feel they are tired, go to bed and they are fine, continue the next day. At what point should you meet a doctor? What are the signs? There should be something.
Yes, there are symptoms that an individual will experience that will help him or her to identify that he or she is going through stress. One of it is fatigue. The person is easily tired, cannot continue with his work, can have changes in eating habits. The person may begin to overeat or undereat. If he overeats, he will begin to add weight. So basically, it's not everyone you see who is fat that is really enjoying, as people term it. It may be a sign of stress. The person may begin to have physical symptoms of disease like hypertension, which could lead to stroke. The person may begin to display emotional symptoms like withdrawal, anger. Those are things that you need to look out from. For irritability, the person gets easily offended. Have you ever walked in the market before and then you just step on somebody's feet and the person is all over you? Is a sign of stress. So at that point, the person needs to take a break. Even for a few hours, just take a break. A day, 2 days, take it off, go and rest, unwind, and return back to work.
Okay, you can just rest and return to work. You don't need to consult a doctor.
It depends on the severity of the stress. If one is having acute stress, there may be no need for he or she to consult a doctor, because immediately that stress is over, he or she will recover.
Like reading for exams.
Yes, like reading for exams, reading for an interview. You have a task to accomplish in the office. Immediately you're done with it, that stress is over, so you don't need to see a doctor.
And that's a good stress.
It is a good stress. Like I mentioned, there are good stress. A good stress, also known as eustress, is a stress that motivates you to achieve your goals. You want to read for an exam, you want to attend an interview, so you have a goal you want to achieve. Though it is challenging, but you are willing to go all out to achieve your goal. Unlike the bad stress, which is known as distress.
Distress.
Yes, the bad stress is known as distress. It brings pain. It's not pleasant. It does not produce good results. So no one wants distress.
This is when you seek help.
Yes. Once you identify that you're in distress, it is important that you seek help. For you to know what are those things, factors or stressors that predispose to this distress. You have them: biological factors, illness, trauma, injuries. Those are biological factors. You have environmental factors such as poverty, unemployment. A lot of people who are unemployed, they do not have food to eat. That's a source of stress. Family, you can have issues in a family. When a couple is dealing with a divorce, or they just lost a family member, that could be a source of stress. So the way you manage stress depends on the type of stressor that you're dealing with.
That's a good one, doctor. So it is necessary to identify what you're going through.
Yes.
Get to know what you're going through and know the right person to meet. Not when you're preparing for exams or you have a task to perform at the office and you're like, I'm stressed out. Of course, once you're done with all these things, you're okay. You can just rest, sleep and rest. But when you are distressed, you understand that stress can lead to distress. So when you are distressed, seek help from a medical doctor. Okay, doctor, thank you very much. And is stress mental, emotional, psychological, physical, spiritual? Can you talk about these things?
Okay, so stress itself can result in physical, emotional, and social or mental effects. So it has a way of affecting people physically. The symptoms I mentioned earlier: fatigue. So if an individual is affected by stress, could display signs or physical signs of stress: fatigue, loss of appetite, increase in appetite, obesity, and all of that. I mentioned emotional symptoms. So stress can also lead to emotional symptoms like irritability, withdrawal, anger issues. Someone who was not always angry suddenly becomes angry. That could be a sign of stress. Someone who was always, outgoing suddenly withdraws. Social withdrawal. That could be a sign of stress. So those are things that you need to look out for. Even behaviorally, someone who used to carry out his or her tasks on time before suddenly begins to procrastinate, suddenly begins to make errors at work, no longer paying attention to details. Those are things that you see that helps you to know that an individual is going through stress, physically, emotionally, behaviorally. Even sometimes you find people who begin to abuse drugs. They go into substance abuse as a result of stress and begin to do a lot of things that they never used to do.
At this point, individuals have to watch out.
Of course.
And then take necessary steps to ensure that he or she is fine again. Like you mentioned that one could, treat yourself to some things you love to do. You can read your books, you can listen to music, You can do other things that give you happiness.
Yes,
Could these things help individual come out of stress, especially the chronic type of stress?
yes, it is very important. In managing stress, it begins with awareness. You must be aware that you are stressed, because if you're not aware that you have a problem, then you not look for a solution. When you are aware that you are stressed, the next thing you need to do is to identify the source of that stress. What is the stressor? Some may be having physical stressors, financial stressors, environmental stressors, and all of that. So identify your own stress and look for the solution. And part of management of stress is self-care. Self-care. People go all out for others, but they spend little time on themselves. You need to care for yourself. Carry your own health on your head. Ensure that you are healthy, because if you are not healthy, you cannot take care of others. So self-care is very, very important. You need to engage in exercise, daily exercise, 30 minutes at least 5 times in a week. Eat healthy diet, fruits and vegetables. Drink plenty of water, play music, and relax. It is very important.
Thank you, doctor. It is important to take care of your health. After all, it's a healthy ones that actually live the life. After working every day 24 hours, some persons would just even say 24 hours is not even enough to do their chores and other job. So when you're healthy, you'll be able to take care of yourself and enjoy the life. So doctor, I'm always eager to know, because people talk about spiritism. Like for instance, you hear somebody was walking and all of a sudden slumped and died, or the person was just resting and did not wake up, and people would say a ghost was sent to eat the person and the person died. So do you believe in this? Would you say this is as a result of stress?
Okay, I want to believe that stress may be a contributing factor to some of those sudden deaths. Why? Because stress is associated with hypertension, and hypertension can lead to stroke and sudden deaths. So most of those deaths are actually medically inclined, and so they need to look for the cause of death. I don't want to believe that there are spirits responsible for those deaths. These are preventable causes, deaths that are preventable if we are able to identify the problems on time and visit the hospital to receive the needed care and attention. We can recover, or our people can recover and live a better life.
Thank you very much. A word is enough for the wise doctor. And now I want to know, do children also go through stress? What are the things that can make a child stressed up?
Yes, children can go through stress in different ways, especially children. You see these days, a child as little as 1, 2 is going to school.
Already in school.
And that's because their parents need to leave for work, they need to go and hustle. And that child will wake up as early as 4:30 a.m., 5 a.m. I will not return home until 5 p.m. in the evening. That is stress. As if that is not enough, the child will return home and will need to sit down and begin to do a lot of homework that he or she has returned with. And over the weekend, this same child does not have the opportunity to rest. You have lesson teachers coming here and there, the children are going for lesson and all of that. That can be a reason why a child would be stressed. And then sometimes some parents overuse their children. The house chores, I'm not saying children should not work, yes, but there are age specific roles that children should carry out at home. But there are some parents that leave all those responsibilities for their children to handle. That is a form of stress.
And some parents, even during holidays, will also send their children for lessons. They are like, I don't want my child to be lazy at home. What will he or she be doing in the house? She has to be meaningfully engaged. Parents, children should be allowed to be children at least once in a while, because you can stress them out. So you're hearing from an expert now that children too can be stressed. So we should know when to allow them rest and when to let them work, because they are children. I thought this was just about adults, ma. So children too can also be stressed. Can you, ma, take out time and elaborate on the effect of stress, and if it is not properly managed, what are the things, what are those ills that this stress can lead to?
Okay, so I would like to say that stress can affect every part of the body, starting from the brain. Can cause difficulty in concentrating. It can lead to anxiety, depression. It can affect the cardiovascular system. When it affects the cardiovascular system, it leads to conditions such as hypertension, can lead to stroke, which eventually can also lead to death. I like to inform you also that stress can affect the joints. Have you heard of people complaining, I'm having muscle pains, my legs? That could be as a result of stress. And part of the management is to engage in exercise so that those things would, the situation would improve. Stress can cause a depletion in the immune system. The immune system has the soldiers that protect the body and fight against infection. When an individual is stressed, you find out that he or she will be prone to different forms of diseases. It can affect the skin, the guts, and different parts of the body. Mentally, it can cause anxiety, mood swings. I'm happy now, the next moment
so sad.
I am so sad and angry. It can lead to depression and all of that. So stress is something that we should stay away from, because if we are affected by stress, it can lead to so many complications. Even social isolation, withdrawing, people withdraw from their friends, begin to abuse drugs and all of that. Those are effects of stress that we do not want to have as individuals.
Okay, doctor, thank you very much. I have a concern. You mentioned that somebody can be financially stressed. That is, poverty can lead to stress. You don't have something doing and all those things. That means, don't you think that governments have a role to play to help individuals balance their lives?
Well, it is true that the government has a role to play to help individuals, but well, to be honest with you, we all know the current situation in which we find ourselves today. If we are waiting for the government to help us, then we will never come out of unemployment. So I would like to advise young people, if you're unemployed, go out and learn a skill. In fact, I want to believe that those who are skilled are making it better than those who are even working. Take for example a tailor. There are tailors around my house, and I see that at all times they are sewing. Either they are sewing for a wedding or a burial or something. They have money. They are being paid. They make money daily. So why wait for the government to employ you? Learn a skill. When you learn a skill, then you employ yourself and you can employ others. You'll be able to fend for yourself, and then there will be no reason for you to be stressed financially.
And transfer aggression on your parents or your siblings and all your friends and start to withdraw. So it's necessary for us to be meaningfully engaged. When government is not employing, you can get yourself engaged and have meaningful life, and you'll not be stressed out. Thank you very much, doctor. And another thing that we are going to look at is are there drugs that can help people going through stress to manage the stress? Are there drugs?
Okay, so I have mentioned that there are different types of stressors. You have physical stressors, biological stressors. So if you're talking about biological stressors, like I mentioned earlier, you're talking about illnesses, trauma, abuse. Yes, so for that there are drugs that can be given to manage such an individual. We just finished talking about environmental stressors. Now, environmental stressors, one of it is unemployment. So there are no drugs to manage unemployment. You need to get something doing for yourselves. So it depends on the stressor. If the stressor is a biological stressor, then you'll be able to get treatment in the hospital. If the stressor, for example, is a personal stressor, do you know that people stress themselves personally?
Okay.
They compare themselves with others. Mr. A is like this, Mr. B is like this.
When you can't,
I want to be like Mr. A and Mr. B. So you set high goals for yourself that cannot be achieved, and at the end of the day you become stressed and sad, depressed, because you were unable to achieve your goals. So if you are such a person that is you're stressing yourself on your own, then you need to work on yourself.
Come out of it.
Work on yourself, develop yourself to become everything that you can be. There's room for personal development. Instead of comparing yourself with others and wanting to be like them, work on yourself so that you can become a better person. Some people are perfectionists. They want everything to be perfect. So if it is not perfect, if it's not done the way they want it to be done, they become sad, they become stressed. So that does not need medical treatment. The individual needs to work on himself or herself to be able to come out of that type of stressor.
So it's only biological stressor that need medical treatment?
Of course, biological stressor is the only form of stressor that will require medical treatment. But aside from medical treatment, when we talk about medical treatment now, we are not just talking about drugs. So even if they have different forms of stressors, they can still, seek medical attention. Medical attention will be important for counseling. When they see a mental health physician, the mental health physician will counsel them. That will help them to come out of whatever they are going through. So everyone, let me conclude that they all need medical attention for counseling and then for treatment.
Okay, thank you very much, Dr. Elizabeth. At this point we will call for a break and Health Matters will return shortly. Please stay.
There's no hurt or sorrow. There are ways to get there. If you care enough for the living, make a little space, make a better place, heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you.
Welcome back, and this is Health Matters. If you are just joining us, we are discussing stress management, and I have a doctor in the house. She is Dr. Elizabeth Ino, consultant, public health physician and wellness coach. She has done justice to the topic, and as we're about to wrap up, she's going to tell us advice on how to live with stress, how to even do away with stress, and what to do if you are stressed out. Once again, welcome, ma'am. This is what you have to tell the public.
All right, I would like to say that stress is a normal thing. It is something that everyone will experience. The good stress is what every one of us wants, because like I mentioned, the good stress helps you to achieve your dreams and help you to develop yourself as an individual. So if you are stressed negatively, if you're having distress, what should you do? Identify the source of stress, manage the source of stress. Self-care is very important. I'm going to emphasize on that again. Self-care, take care of yourself, and don't die alone. If you have any problem, you're going through any form of stress, talk to someone about it. Talk to your friend, your family members. Look for a doctor that can manage the situation for you. Don't stay alone in isolation. Relate with people and tell them what you are going through. Someone may be able to help you. And then don't overburden yourself with lofty goals that are not achievable. Whatever goal you're setting for yourself, let them be realistic, things that are achievable, that will keep you happy and away from stress.
Thank you very much, doctor, for doing justice to our topic today, stress management. I think that is enough for you to listen to and to take care of yourself. Do not want to be like A or B. Just be yourself. Go out there, get meaningfully engaged, and be yourself. Be happy. Because if you want to be like Mr. A or B, you'll be stressed out and go into depression. So many things will follow. So just be yourself and live a happy life. Thank you very much. We may need you some other time. and we believe that you'll be here.
Thank you for
Thank
having
you,
me.
Dr. Elizabeth.
Thank you.
So this is where we wrap it up on Health Matters today. See you next time, next Thursday, for more interesting topics. Take care of your health.